In March of 2018, ANZUP hosted a meeting of key clinicians from across the Asia Pacific region to discuss whether the St Gallen Advanced Prostate Cancer Consensus Meeting recommendations were applicable in the real world situation, particularly in the Asia Pacific region. It was a great meeting and very informative because we learned that there are substantial differences in how prostate cancer is managed across the region. A lot of this comes down to availability of resources. So, for example, not all drugs are approved in all regions, but it sometimes is at an even more basic level. For example, in Indonesia, it's very difficult to access isotope bone scans. And so the simple evaluation of patient staging and evaluation of response to treatment is very different in countries with those sorts of constraints. There are also other differences that we recognise. There are differences in how Asian men, for example, tolerate docetaxel dosing. There are cultural issues in terms of patient preferences. The cultural issues tend to weigh against the use of intravenous chemotherapy and more towards oral therapies. There are cultural issues sometimes in even being made aware of the diagnosis. There's dosing issues in terms of starting doses of docetaxel. Asian men don't tolerate 75 milligram per metre squared nearly as well as Caucasian men do, and so the starting dose is more likely something like 60 milligrams per metre squared. So we found that there are very substantial differences in the overall approach to management of patients, resource implications, and simple things such as evaluation of response or progression.